Thank you very much. Well, that was a very interesting narrative around how the analytics can be applied in a very large scale in the whole spectrum of healthcare. So I have to invent another story.
Right.
I guess a little bit of a background. I come from Montefiore. We compete in everything that Mount Sinai does in the same region. Montefiore is the leading accountable care organization, which would give you a sense of why information are important for us, because we really need to understand our patient population and interaction of our patients with our healthcare system, not just as they appear in front of our doors, but after they leave us and as they engage with their community and live their lives out in the wild. I also represent Einstein College of Medicine, which is a medical college focused on basic science and translational research with a focus on precision medicine, which is, I'm sure, something that everybody knows about recently. That's a direction that the president put forward in terms of the future direction of the research and research funding. And long story short, it means understanding our patients and our population with very granular personal detail, coming not just from the genetic analysis of the patients, but also understanding their history, their background, their family tree, and the life experiences of every single member of their family. And these are also other aspects of why information is significant for an institution like Montefiore or Einstein. We basically, as informaticians in this institution, have to cater for two ends of a spectrum where precision medicine, a very granular, detailed understanding of an individual in their family requires us to look into a different kind of data set, and where accountable care organization, which is our operational delivery of care system, requires us to bring yet another level of data and data processing and integrate them in a way that you can build models that can go through across the spectrum and make it available to researchers. We also participate in a lot of multi-institutional research. We work with pharmaceutical companies on clinical trials. We are, as we speak, in the process of building a collaborative in New York through PCORI's Clinical Data Research Network to integrate our clinical research enterprise with our collaborators and partners in the city, with Columbia, Presbyterian, Mount Sinai, Cornell, Rockefeller, State Department of Health, which means whatever it is that we are doing inside our own walls have to be interoperable, integratable, and linkable to the data from the same cohorts of patients in other institutions for us to be able to create a longitudinal, comprehensive view of our patient information and use that for comparative effectiveness research, for outcomes research, for clinical trials in a multi-institutional setting. That also gives you another perspective on what are the kinds of information and kinds of infrastructure that we need to plan for in order to not only bring this information together and make it ready for analysis, but also make it ready for collaboration, make it ready for exchange in large scale with other institutions. So that's the ecosystem that I'm representing, and that is what is driving Montefiore's understanding of what are the infrastructural investments that we need to make in our big data analytic infrastructure. We need to build infrastructure for bringing our genetic data next to data that our clinical operations generates, link it to our clinical research enterprise with ability to follow through our patients, whether or not they participate in multiple levels of clinical trials or not, ability to tie that to the machinery that we have inside our hospitals. We have projects that are trying to build predictive models for the next, patients that we anticipate that will need ICU in the next 72 hours. We really want to know who is going to be intubated in the next 3 days and preempt that. And in order to do that, you need all kinds of data. Some of them are more static data from stuff that you can get from your labs and EMR. Some of them come directly from the devices that you attach to the patients, from your monitors and devices in your clinical setting, which produces massive amount of information. And not only you need to bring that in and integrate it, you need to have ways of consistently analyze, interpret, create alerts and notifications that you can distribute correctly among the participants of the care, and maintain that for the future research as well. We are building infrastructure for all of that. Our operational setting, as I'm sure is true for all other healthcare systems, is interested in building outcomes measures that can predict patients that will require readmission, and somehow preempting those readmissions. We are setting up our analytic infrastructure in preparation for those. Our cardiogenetic program is setting us clinics that they can follow from the genetic analysis of the patients and patient family members in order to prevent from sudden cardiac death, as one of the initial projects that we anticipate that will enable us to use genetic information in advancing our clinical programs in Montefiore. So these are basically some of the instances of how large-scale analytics across the spectrum, from the personalized medicine to operations of an accountable care organization, is being applied in Montefiore. We also have some interesting technical bend on how things needs to be done. We are partnering with Intel and Franz and some other technology providers to build a knowledge-based analytic enterprise. We call it Semantic Data Lake. I can explain later on what we mean by that. We hope that we will have also a technical contribution to the field other than scientific and clinical one.